This list is by no means exhaustive, but gives a good example of some of the larger barriers that are faced, such as economic and geographic, cultural, education, and language, as well as mental health and stigma. So for economic and geographic barriers, these can look like access to healthcare facilities or grocery stores. Jasmine mentioned food deserts earlier in the conversation. It can look like exposure to pollutants for certain neighborhoods, usually lower income neighborhoods and lower income populations. It could be a lack of reliable transportation. You might have a medical appointment, but it might take 2 buses or 3 hours or just different ways to get there. You might have access in your own community to access the healthcare that you need. And it can also be high costs of insurance, medical expenses. Again, the insurance and the medical field and the healthcare field is very difficult to navigate on its own, and it can be very expensive. And so it can be very hard to access some of that care. And then finally, also, it's difficult to access healthy food or activities or safe spaces to engage in wellness activities, engage in healthful activities, eat good food. Those are just some of the economic and geographic barriers. And then there's cultural, education, and language. Not having resources in your native language can really be hard to navigate what care is available, what you need to do, where you can go. If you don't have access to that in your own language, if you don't have access to providers that speak your language, there's that cultural difference, that cultural disconnect. And then the education itself, again, in an already complex system, when you add these additional barriers, whether it be language or access, it can be extremely, extremely difficult to navigate and hard to really understand important health information and how you can better your health outcomes for yourself and for your family, your community, your loved ones, etc. And then finally, we have the mental health stigma and the way that it's perceived in society. So there's the cultural stigma around mental health, and then there are all of these intersecting challenges like historical trauma, social stressors, discrimination that still exists, and it compounded with the cost, the long wait times. And again, bringing it back full circle to the beginning of the barriers discussion is geographic distribution of services. Are these services even available in the area where you live? Can you access mental health where you live? So addressing these complex social, economic, and systemic barriers that contribute to health disparities is really crucial to achieving true health equity for all.